Good afternoon. I am going to call order of the Health, Hospitals, and Social Services Committee. I detect a quorum, and the first item that we have on the agenda is a resolution 2019-91. Mendez, Hurd, and others. That approves an amendment to a grant contract from the Tennessee Department of Health to Metro Health to improve the health of those residing in or visiting Davidson County through targeted strategies. Mr. Sharp?
Motion.
Second.
Oh, sorry. Yeah. Is there a motion?
Did you want me to move it?
Thank you. Mr. Sharp, this is the one for the control of tobacco use.
Yeah, that is there are two state-funded tobacco programs. This comes from the Master Settlement Agreement that now fluctuates. This is $200,000, I think. We do 3 or 4 different programs for that. Breathe Easy for multi-unit places. We do cessation with the HUD facilities. We do something called a CEASE program, which is with pediatricians for having the conversation about tobacco use in the home. Several different things at that fund.
Absolutely. Any questions for Mr. Sharp? All in favor?
Aye.
Great, thank you. The second item that we have is Resolution 2019-92, and it's a grant from the Tennessee Department of Health to Metro Health to provide a viral hepatitis program services aimed at prevention, testing, diagnosis, surveillance, and linkage to treatment and other support services.
Motion.
Second. Thank you.
It wasn't until 2017 that Hep C was a reportable disease because there was nothing to be done if you had it. It is now curable, and so it's a reportable disease, and this funds a position for a lady who tries to help people get connected with treatment.
Okay, all in favor?
Aye.
Resolution 2019-93. This approves an amendment, 1, to a contract between Metro Health and Nashville Academy of Medicine to provide access to the Charisma Salus database system for patient and prescription tracking. Is there a motion?
So moved.
It is primarily a function of the Safety Net Consortium to try to keep up with folks that are in that system to share the data with the National Academy of Medicine so we can tell what's going on with this.
All right, any questions?
So the effect of this is just extends the date of the contract for 1 year from June 30th to June 30th, 2020?
I think that's right. We've had this contract for 5 or 6 years now, I think. I think it just moves it up 1 year. We pay them a relatively modest amount of money, $2,000 or $3,000 or something, I think.
And I don't see any fiscal impact to us beyond that, so.
All in favor?
Aye.
Thank you very much. Resolution 2019-94. This resolution approves a contract for services between Metro Health and TriStar Centennial Medical Center to make available to potential eligible individuals information about women, infants, and children, program benefits, and how to apply for those benefits. Is there a motion?
So we have these agreements with all the birthing hospitals to find the women and children who are, the children are actually the eligible party. They're eligible for WIC services at birth. They get them enrolled and send them home with all the information they need to continue in the program. It's a nutritional education program.
Okay. Any questions about that grant? All in favor?
Aye.
Did you have a question?
Just one brief.
Councilman Pulley does have a question.
The term of the contract, 60 months from the date that it's approved, and I understand there's no cost to the Metro Board of Health for the performance of the services under the contract. Is that correct?
They do that through the WIC program.
Okay,
They're
thank
WIC
you.
employees.
So, Resolution 2019-95 approves a contract between Metro Health and University of Tennessee's College of Nursing to provide clinical experience opportunities for its students enrolled in the graduate and undergraduate nursing programs. Is there a motion?
Second.
We have these similar agreements with nursing schools all over the place. They come in, most of them only come for a day.
Right.
Basically, we tell them a little bit about what public health is and show them around the building and encourage them to come to work for us and they get out for
Right,
a salary that they can get somewhere else.
I remember this from years ago, every year. Any questions regarding the nursing program?
Again, just highlighting that there's no cost to us for participating in this program.
That's correct.
That's awesome. All in favor?
Aye.
Thank you very much. Resolution 2019-96 approves an agreement to detail for the Public Health Associate Program between the Metro Health and the Centers for Disease Control and Prevention to provide an associate to assist public health agencies in developing, implementing, and evaluating public health programs.
So moved.
Second.
This is one of my favorite things. The CDC gives us these really bright young people come in. They stay for 2 years. They work for us. They're paid by CDC and they work for us. Not only do we not pay anything, we get 2 years worth of work out of these.
That's
very
awesome.
awesome.
That is very awesome.
We give them a place to sit.
And they may come back and live in Nashville. We make it
They
so
do.
wonderful for them.
Some of these kids are on staff. They're not kids. Some of these young people are on staff.
Awesome. All in favor?
Aye.
Thank you very much. Resolution 2019-97 accepts an opioid overdose reduction program grant from the U.S. Department of Justice, Office of Justice Programs to the Metro Board of Health to address prescription drug and opioid misuse, save lives, and reduce crime through a comprehensive and collaborative approach.
So moved.
Second.
So this is new. This is a grant from the U.S. Justice Department. So it's a little bit different from the normal string of money that we get. But it is an effort to, we have the Metro's opioid response coordinator is lodged in the health department. And so he's trying to pull together all the facets of the community, the EMS folks, particularly on the front lines for that, the police, all the hospitals, everybody that's affected by this, and it's not getting better anytime soon. So this is a pretty good piece of money. It's $1 million.
Yeah.
And I think that's for 3 years. And there's another one coming. And a lot of them are very similar kind of things. One of the things they want to do with this is they would do a lot of surveillance so we know where the hot spots are, what the drugs of the moment are. They do what's called an OD map, which is basically a real-time map of opioid responses.
Right.
So if you have a bad batch, for instance, of something around, you can put the word out, hey, you need to watch out. Somebody's got some bad stuff over there.
Well, considering this, I would assume that you all will be working with nonprofit organizations that also deal with substance abuse and that.
That coalition is a fairly large group of people.
Okay, so with that, I will abstain considering my day job on this vote. Councilwoman Benedict?
Thank you, Chair. So I think in Budget and Finance, this came up. Just want to make sure there was a question that I believe Councilman Glover had, which was how does this relate to state and federal government? Obviously, the federal government is giving us this grant, but how does this relate? I think it'd be.
He was asking about the class action lawsuit that's going on in Cleveland,
right.
to which Metro is a party.
Got it.
It's a class action suit by various and sundry jurisdictions, states, cities, counties, all sorts of governments. That are suing primarily the manufacturers of the opioids to try to recoup some of the costs that they have had to put forth to deal with these issues.
So non-related completely?
It's
unrelated.
related to the opioid, to the addiction crisis, generally
To the
speaking.
word opioid, right.
But
Okay.
these are two different things.
Thank you.
Okay, any other questions? All in favor?
Aye.
Thank you very much. And the last one we have for today is Bill 2019-44, which amends the Metro Code Chapter 1016 to modernize the existing ordinance and authorize the Director of Health to initiate disease control measures for any reportable communicable diseases as defined by the Tennessee Department of Health or any notifiable infectious disease as defined by the Centers for Disease Control and Prevention.
So moved.
Second.
So this one actually came to us from the legal department. There was an outbreak of something weird. I can't even remember what it was. I think in Nebraska. And what they found was that they could not respond like they wanted to because it wasn't on the list of reportable communicable diseases. And what this does is saying if there's something that's not on this list, and I brought a copy of, there's a whole bunch of stuff on there, and it's updated regularly. But if something pops up that's not on there that we need to respond to, and it's identified as such by either the state health department or the Centers for Disease Control, then the director is authorized to do what he or she can do for any other community.
Okay, great. Any questions for this? All in favor, say aye.
Aye.
Thank you. I want to say that last week that we had a wonderful women's roundtable discussion over at Nashville General Hospital, and they also had a press conference about the leapfrog ranking that they received. They moved from a D ranking to an A, and it was very, very exciting. I'm excited for them and the great work that they're doing. Thank you very much, Council Lady Welsh, for attending, and I hope you all, and I know you were not able to, but we know that your support was there. So thank you all again for this meeting today, and hope you have a good rest of the time.
Thank you.
You get invited,
As meeting adjourned. Meeting adjourned. It was on your.
I know, it was,
They're all organic grapes.